they hope that Obama would be different, right? Change we can believe in. But that, by the very nature of that, the profits and power of these industries will not be challenged in any meaningful way. It's really window dressing. And that, of course, is the source of the problem, is the for-profit insurance industry, and related to that, the for-profit pharmaceutical industry. And it's very much like the banks, right? The people who are responsible for the crisis that destroys our lives, they're put in charge of fixing it. I mean, there's something wrong with that. There's something fundamentally wrong with that. We hand them billions and billions of dollars in TARP money. And then the healthcare will give them billions of our taxpayer money to supposedly fix the crisis. And it's completely wrong. The House bill that passed is called the Affordable Health Care for America Act. It's not going to be affordable. The Senate bill, this is even better, the Patient Protection and Affordable Care Act. We call it the Profit Protection Act. And really, if you have the stomach to look at the legislation, the Senate bill is over 2,000 pages. The House bill is over 1,000 pages. It's just a complete capitulation to the robber barons of the healthcare industry and the pharmaceutical industry. What it does, in a way it never did before, it really enshrines their monopoly power because of the money they're going to get and then the mandate that they're going to get. So billions of our tax dollars funneled into the insurance company coffers to provide subsidies, right, for people who can't afford insurance. And so then you have to ask the question, well, if we're reforming healthcare, why would insurance still be unaffordable? Like, why would we need to subsidize people? Like, why wouldn't the price of healthcare come down so much if we're reforming it that we wouldn't need all these government subsidies? And nobody asks, at least in the mainstream media, nobody asks that question. So just do a quick recap of what this legislation, there's so many poison pills, it would take hours to describe them all. But just a couple of them. There's no price control, so they can charge whatever they want. That's how they're going to get around the pre-existing condition. They have to take people who have health problems. The way they will pay for that is raising everybody's premiums. And there's no control on that. The government's not saying you can't charge over a certain amount. They can still deny care by saying it's not medically necessary. And that's really the source of a lot of the healthcare horror stories. They deny people transplants. They deny them all kinds of doctor-recommended treatments. They can still do that. There's a few exceptions, but even that, they'll find a way around it. Okay, I talked about the pre-existing condition. The mandate, forcing everyone to buy health care. They get all these new customers, and there will be a fine. In Massachusetts, it's $1,000 a year. They take your tax refund from you. We don't yet know what mechanism they're going to use here to do that. Both pieces of legislation have that. Healthcare is still a commodity under these schemes. They estimate even 10 years out, there'll still be over 20 million, 20 million with no insurance. It leaves out the undocumented, and it doesn't go into effect until 2013 or 2014. So it's like, hurry up and wait for this reform, which isn't really going to fundamentally transform anybody's experience with the healthcare system. That's a cynical election year maneuver, which again, most people can figure that out, right? And I just have to say this. I just have to say this about the Republicans because they kept saying, this is a government takeover. I wish it was a government takeover, but it is not. It is the furthest thing from a government takeover that you could ever imagine. And so this bill, whatever it is, they call it the sausage making process. Maybe we should call it the, what is it? Wisconsin is famous for bratwurst, right? The bratwurst, emphasis on worst, process that's going on there where they're trying to put these two bills together. So now I just want to end and talk about what we did, what our side did, the grassroots movement for single payer. Expanded and improved Medicare for All, HR 676. What did we do in this last year and a half, 2 years? Well, we started out with our core belief, which we never compromised, and that is that healthcare is a human right that should never, ever be be taken away. Our government should guarantee it. Nobody else can guarantee that. And the majority of people in this country are in favor of Medicare for all. They might not call it single payer, but they want the government to guarantee health care, and they hate the private insurance industry. Poll after poll shows that. National organizations like Healthcare Now have chapters all over the country, and then there's hundreds of other small grassroots groups that have sprung up. Of course, we have Physicians for a National Health program, and they have chapters all across the country. They have 17,000 members now. More people are joining every single day. We have the California Nurses Association and lots of other groups, Labor for Single Payer, although labor has been a problem because SEIU and other unions have not endorsed, and that is an obstacle we have to overcome the next round. We took direct action. The people who stood up in Max Baucus's hearings, doctors and nurses and activists that got arrested, got taken out of there. That was enormously important. That's never happened before in our country. We had the mad as hell doctors. I know they came here, right? They went to something like 22 cities. They had a meeting of 700 people in Oregon. We had close to 300 in Chicago. Again, unprecedented. Doctors getting it in a van and crossing the country. They used to be the problem. They used to be holding back healthcare reform in this country. And they came to Chicago, and it was great. Their motto was get mad, stay mad, make history. And it was so great. I don't know if they did it here, but in Chicago they had a mad as hell minute, and you could get up in front of the camera and do a mad as hell, and so many people did it. It was wonderful. And then we launched a couple months ago a civil disobedience campaign across the country. And so there were 35 different civil disobedience actions. Over 100 people got arrested at insurance companies. We got some press, but not nearly enough, because it will come as, again, no surprise to folks here. There's been a media blackout on our movement. We don't get nearly the amount of coverage, examples, as say, the teabaggers did, and they represent nothing. They got so much more coverage. That is also infuriating. So really, we have a lot to be proud of this time around, and our movement has to grow. That's our problem. We have to get larger. We weren't strong enough this time around, unfortunately, to win real healthcare reform, healthcare as a human right. And our enemy is incredibly powerful. They're well-financed, and they're in the corridors of power every single day. And we're not going to put 1/6 of the economy out of business if we don't have a large, powerful movement in the streets that won't take anything less than a single-payer system. We have to continue to build that movement. That is our job. But we have created a movement where really nothing existed. We have a lot to be proud of. And really what we're building is a civil rights movement for the 21st century. And I want to just end with a quote from Howard Zinn, the American historian. He was just in Chicago, and he spoke to an audience of almost 1,000 people at a meeting of the conference for the campaign to end the death penalty. And there were a lot of fighters against the death penalty in that audience. And this is what he kind of closed out the meeting by saying to us about keeping up the fight. He said, if you join a fight for social justice, you may win or lose. But just by being part of the struggle, you win. And your life will be better for it. And that's really our job.